So, Michelle, I wanted to talk to you, just candidly about plastic surgery, because I know I'm going to be 44 years old, and a lot of my girlfriends and I talk about it. It's something we snicker about. Everyone's curious, but people are afraid to come in and get a consultation. I think that they almost fear like someone's going to see them or know that they came, or they're going to look stupid if they ask too many questions. So I thought I would talk to you today about just some of what I know many women my age and a little bit younger and a little bit older are curious about, and it would be great if you could kind of share with everybody what people should know about the reality of plastic surgery today. So first and foremost, I guess today's plastic surgery is not your grandmother's plastic surgery, right?
Right. So plastic surgery in the past, I actually just had a friend who said, my thought about plastic surgery is a 70-year-old woman walking into an office who's well-heeled, who's ready to get her face done. And, one of my mentors called it TWT, the whole thing. And some well-heeled woman would come in and have her brows, her eyes, her face done. And that's one misconception of plastic surgery. Because I'd say nowadays, younger women are a little more sensitive to looking energetic, and they're competitive. They're in the workplace with other women, with other men, and they want to look good, and they want to look how they feel. So people are starting younger and moving in smaller steps, and I'd say it's even as early as 30s where we're starting to do things like Botox just to kind of smooth the lines, and then maybe just an eyelid lift because they're starting to look like their mother, and then you kind of can gradually amp it up as people get older. And certainly plastic surgery also isn't 90210. It's not big breasts, big lips, a big butt. It's not Kim Kardashian. It could be, but that is not what plastic surgery is all about. It's really to achieve the best you that you can be, and to actually bring out the you that you feel, not some kind of other person who you want to emulate.
So what would you recommend if someone was thinking about plastic surgery? I mean, obviously come in and see you for a consultation, but what are some of the first steps that people can take if they're really seriously considering having a procedure done, whether it would be on their face, or they want to get a breast lift or a breast reduction or some kind of mommy makeover or body contouring? Where should they start?
Well, there's a lot of information. Some is really good and some is really bad. As we know from the internet, you can find some great educational tools and some very poor ones. I'd say that my website, drshermak.com, definitely has some great educational tools. Our national societies, the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgeons, one is plasticsurgery.org and one is surgery.org, both have excellent tools as well. And you could do a little background research, first, but generally, I like when people come in with an open mind. They have a goal that they want to achieve, and then we can talk about their custom approach. Nothing is cookie cutter. So I do like for someone to understand, yet to have an open mind about the possibilities.
Great. And also I noticed that more men are looking into plastic surgery. It's kind of a secret in the locker room, I'm sure, but I've heard that men are some of the fastest growing segment of new patients, particularly for some of the injectables and the minimal invasive treatments. Can you talk to me a little bit about that and why a man would even consider plastic surgery?
So if you think about Mark Zuckerberg, you can see why men are starting to think more about youth. This has really become prevalent, particularly in the Silicon Valley area, where ageism is a big deal. And men who are looking older, maybe a little more tired, are not as competitive as some of these young guys who seem energetic and out of the box and full of ideas and potential. So I'd say men are doing this more, probably partially professional, partially to look good for a partner that they're interested in. And things really range as simple as non-invasive skincare, and we have Ultherapy, which is a facial tightening therapy, up to minimally invasives, our Brotox or Botox to smooth lines, and fillers, which also help particularly in the tear trough area where people can look tired or have dark circles, we can fill that area and fill some of the lines. And then we obviously have our surgical alternatives, which some men are very happy to do, because our surgeries, while they're impactful in their results, the scars are very well concealed. So sometimes that's the right thing for a person.
So walk me through if somebody wanted to come in for a consultation, because I think sometimes there's a lot of hesitation. They're worried they're going to be hard sold. They're worried that, you know, they're going to have to make a decision right away about a procedure. What can someone expect if they're coming to visit you in your practice?
They should expect a conversation, and they should expect to meet with a very friendly, courteous staff who are obviously well-schooled in confidentiality. And basically I meet with the patients one-on-one, and we sit down together, we chat together. I try to understand what the goals are. It's a medical meeting, so I want to understand medical background, because that's very important. That's how we're trained to be safe, and then we try to discuss options that they can pursue. And you know, certainly there are some people who are ready to kind of sign on the dotted line immediately and get their surgery or treatment date. There are some people who we treat that day if it's something that's minimally invasive and they can walk out done. Or some people come back after 2 years, 3 years. I've had people come back after 5 years because it's a better time for them. There's no pressure. I just want to educate and make sure that if somebody is going to do something, that they understand what they're going to do, that they feel comfortable with their education, and that they're ready.
Excellent. So the last question I have for you is, you know, you chose this field because you wanted to help people and you were fascinated by kind of the combination of medical and artistic aspect. You have this wonderful expression you use to kind of help brand your practice and promote your practice, which is, it's your life, make it beautiful. What does that mean to you? Could you explain that a little bit?
So I get nervous about this is your life, make it beautiful, that people will think it's vain, or that the concept of beauty is to meet some Barbie standard. And that is really not what beauty is. Beauty is confidence. People can feel confidence when someone walks in a room, whether they have a funny gap in their teeth or asymmetry in their face. They're still beautiful because they own it, and they can fill a room just with their charisma. So beauty is confidence. Beauty is not a gold standard Barbie concept that doesn't even ever fulfill anything in reality. So that's what we're trying to achieve, a beautiful life, a life that someone is happy with, and day to day they're doing things they enjoy and they feel comfortable in how they present themselves.
Great. The last thing I would want to talk to you about is the concept of why not now. And you know, I know, speaking for myself as someone who had, you know, very small procedure, I'm wondering why I didn't do it sooner. And I think that that's something that happens to a lot of your patients. Could you explain that a little bit?
Sure. So people, we talk about when is the best time to do a procedure, and someone has to feel comfortable with the time that we do it, as we just talked about. But there are many people who put it off for whatever reason. They're taking care of their family is often the reason, since a lot of patients are women and they're multitasking. They're taking care of their families, they're taking care of their jobs, they're taking care of stuff around the house, a broken refrigerator, or planning the next family vacation. So why not now is actually a message to women a lot of times who are putting themselves on the back burner, and they should start doing something that's going to make them feel good, because once they feel good, the people around them are actually going to really enjoy that. Right, because if mama's not happy, nobody's happy. Well, thanks for taking some time to talk to us a little bit more about your practice, and you can always go to Dr. Shermak's website at drshermak.com and find out more about the things we talked about, or book your confidence conversation or consultation as needed. Thank you. Thanks.